Good day, my name is Danielle Louise Villaseñor from BSN 1B, and for this video, I will be performing or taking the patient's vital signs, specifically their blood pressure. As for the assessment, first you're going to have to assess for the signs and symptoms of hypertension or hypotension. You're also going to have to assess for the factors that may affect the blood pressure. You have to determine the policies and procedure of the facilities, and you also have to determine the client's record for medication that may increase or decrease the blood pressure of the patient. As for the planning, you're going to have to assemble the equipment and supplies that you will need for this procedure, such as the stethoscope, the blood pressure cuff of the right size, and the sphygmomanometer.
For the implementation, prior to performing the procedure, introduce yourself and verify the client's identity using agency protocol.
Good afternoon, my name is Danielle, Villaseñor. I'm a student nurse from NEUSTCON. So first, may I know your name, please?
Miss Riorita Villaseñor.
Okay. So, Miss Riorita, ang gagawin ko kung paano ko po ng blood pressure. Next step, okay with you?
Okay.
Second, wash your hands and observe other appropriate infection control procedures. Provide client privacy and place the client in the appropriate position. The adult client should be sitting unless otherwise specified. Both feet should be flat on the floor. The elbow should be slightly flexed with the palm of the hand facing up and the forearm supported at the heart level. Expose the upper arm. And then, wrap the deflated cuff evenly around the upper arm. Locate the brachial artery and apply the center of the bladder directly over the artery. For an adult, place the lower border of the cuff approximately 1 inch above the antecubital space. If this is the client's initial examination, perform a preliminary palpatory determination of systolic pressure. Palpate the brachial artery with the fingertips. Close the valve on the pump by turning the knob clockwise. Pump up the cuff until you can no longer feel the brachial pulse. At that pressure, the blood cannot flow through the artery. Note the pressure in the sphygmomanometer at which pulse is no longer felt. Release the pressure completely in the cuff and wait 1 to 2 minutes before making further measurements. Position the stethoscope appropriately. Cleanse the earpiece with alcohol or recommended disinfectant. Insert the ear attachment of the stethoscope in your ears so that they tilt slightly forward. Ensure that the stethoscope hangs freely from the ears to the diaphragm. Place the bell side of the amplifier of the stethoscope over the brachial pulse. Hold the diaphragm with the thumb and index finger. And then you're going to auscultate the client's blood pressure. Pump off the cuff until the sphygmomanometer reads 30 mm of mercury above the point where the brachial pulse disappeared. Release the valve on the cuff carefully so that the pressure decreases at the rate of 2 to 3 mm of mercury per second. As the pressure falls, identify the manometer reading. Deflate the cuff rapidly and completely. When the device has determined the blood pressure reading, note the digital results. Then remove the cuff. And lastly, wipe the cuff with an appropriate disinfectant.
For the evaluation and documentation, first you have to document the blood pressure in the vital signs record sheet. You also have to report any abnormalities to the primary care provider. and document the procedure in the client's record. That will be all for my video. Thank you for watching.